Welcome back to American Medicine Today. I'm here with Dr. Bonati, and I wanted to discuss this misconception with just laser spine surgery. I know that you were instrumental in developing the FDA approval for the holmium YAG laser for use in spine surgery, but that's just one of many tools you use. It's not the only tool. Can you elaborate?
Lasers are instruments. It's specific for certain things. For example, if you do have a bulging disc that you want to decrease or you want to reshape, you may use a laser. But before you get to use the laser to get to the disc, you need to use different type of instrumentation to open the canal to get there. It's like when you want to walk in a room, you first need to open the door. Then you can look inside of the room and use instruments that are going to reduce, correct, or reform the areas that they are producing pain. Laser is nothing more than a hot knife and need to be used properly for proper indication, or otherwise doesn't work.
Just to clarify, for those that would be watching the program, the Bonati spine procedures are not just laser procedures.
No, the procedures that we develop, they use a large amount of different instrumentation. We use drills, we use burrs, we use instrumentation to coagulate the soft tissue cut. We use special heat instrumentations to be able to cut the area of the muscle that is exposed or remove some of the debris on top of the bone. Once we have an exposure of bone, we need to do a laminectomy. The laminectomy is a procedure that requires to open a window on the lamina so we can go and look at the structures inside. That lamina only can be cutted with a special type of saws or with special type of drills and expose the area. But if sometimes we have a bleeding, we need to choose between a cautery that can coagulate the vessel right there, or sometimes it's too difficult to coagulate the vessel in that area, so we may use retractors to expose and use the laser to coagulate the veins or the arteries that they are bleeding in a very difficult positions. So then the laser becomes an instrument that can be used. So as you see, a laser has very small limitation. It's being used in the industry right now as an advertisement tool.
So if someone's trying to say that they do your procedures outside of the Bonati Spine Institute, that isn't true because they're patented procedures exclusive to the Bonati Spine Institute. And if someone is trying to tell you that they do only laser spine surgery and it's the only instrumentation, they should be alerted to that, correct?
If you are just using laser and that's the only thing that you use, you need to understand that you cannot treat the patient, because the laser by itself will not be able to expose the neurological structures that they are damaged or they're injured inside of a cage where the spinal cord goes and the nerves go. So you need to open that cage, and the laser will not do that.
So in other words, you know the true mechanics of the body, and if people don't, then it's easily something to confuse a patient.
I think the intention is confuse the patient.
Yes.
They say we use laser, so laser is a miracle. So wait a minute, it's not a miracle.
So Dr. Bonati, why don't you tell us why and when you use the laser?
Initially in the 1980s, late 1980s, when we developed the technique, we didn't have instruments. Initially, I developed tubes to be able to do a target procedure. Then later on was called minimally invasive and took off in that direction. But really, the procedure that we do is a target procedure. We thought that we can work extra discal. We talk about bulging disc and herniations. So we put the tube, and the tube was very small, was the type of a straw. We didn't have how to look. I thought maybe if I can use an instrument that can produce heat on that disc, will reduce the bulging and will correct the pain. Mm-hmm. Well, didn't work.
What happened?
Patients say, ouch, and then the pain didn't disappear.
Okay.
So we have failures. But then,
And this was in the beginning.
that was in the very
Okay.
beginning. Then we were doing some type of research and development at that time. I went to an orthopedic convention. And in the orthopedic convention, I saw a group of people that they were doing a type of work on a meniscus on the knee. And I go, oh my God, that's the instrument that I need to hit the disc. So I developed a procedure where I talked to the company and we joined to do a development of a research and development of the laser in disc surgery. So we applied for the government to approve that, and we have a few cases that we talked to the patient, said, well, we don't know if this is going to work, but if it doesn't work, we will do an open surgery, but instead to do an open surgery, let's see if this can help you. So the patient said, okay. We apply the laser, but this time we increase the size of the tube, and we put then an instrument to visualize. That was the arthroscope that we're using in shoulders and knees. Then we use a laser, and we found to our surprise that when we touch the annulus is an elastic tissue. This elastic tissue immediately
It could shrink.
Shrink. That's how we start with a laser.
Right.
And that's why we call laser arthroscopic procedure.
Right.
And everybody capitalizing that laser quote unquote miracle tool.
Right.
But then years after I look and I say, this is not working. It's only a very small population and it's not effective. So what I did is I moved the tubes inside of the canal where the spinal cord is. That one, you cannot use laser with that indiscrimination like we use on the annulus. Laser then become a tool that is very limited to be used in the actual spine surgery.
Thank you for joining us on American Medicine Today. We'll see you next time.